Fibroids. I don't know how many women complain about fibroids. So many people have issues with these things. What are fibroids? Why are very many people predisposed to them? Why have they become a whole issue right now? So when it comes to fibroids, these are just how you can say non-cancerous tumors that happen in the uterus of the female. And for some people, they can transform and become cancerous, especially when we see fibroids in people that are above 50 years of age, because ideally at that point, you shouldn't be having fibroids. So fibroids, their cause isn't very clear. They are like how you can see different cancers and what it is that brings them. Their cause isn't very clear, but however, they are very highly attributed to our estrogen levels. That's why they are very high in the reproductive age group, unfortunately. So what are the things that will make women predisposed to fibroids? One, if someone has had early menarche or when someone began their menses earlier, all these symptoms and all these factors are based on the fact that you're going to be predisposed to estrogen for a very long time, or high amounts of estrogen. This is when you begin getting this. So early menarche, or when you began your periods early, like let me say you began them like at 9 years of age, you're going to have this predisposition. Late menopause, so if someone takes long to get into menopause, also gets predisposed. African descent, unfortunately, as Black women, we are very predisposed. There are so many theories that are not very clear. Some actually talk about the theories of like the relaxers that are used or whatnot, but these are all just theories that are not clear. However, as African women, we are predisposed to these, unfortunately, as compared to our Asian sisters or the Caucasians. And then also when someone has not had children. So because you keep on having these hormones that are interrupted in your body for a long period of time, eventually you find that you get predisposed. So how do people present? Different people present differently with the fibroids, depending on their size, on their location, okay? So for some people, most women actually have no symptoms, and you eventually find that they will present with the fibroid. They just see it in a scan, it's an incidental finding. So then also some people will present with things like abdominal uterine bleeding or bleeding in between your periods, or even heavy bleeding, very painful bleeding, pain when you're having sex, pain in the abdomen. Some people will have things like constipation, especially when the fibroid is more towards the posterior end of the uterus and begins to press onto the rectum. So outlet of stool is very difficult, or urine frequency when it's causing irritation in the bladder. So also we have things like subfertility or infertility, depending on the type of fibroids. There are some fibroids which are closer to the inside of the uterus. So we talked about the layers of the uterus, the endometrium, the myometrium, or the perimetrium. So the endometrium is the innermost layer. This is where implantation occurs of the baby. So when, of course, you're having fibroids in this area, every time a baby is trying to implant there, it will eventually terminate and you have recurrent miscarriages. Or eventually you find that people who have like fibroids that are inside the muscle layer, when the fibroid occurs there, it easily causes spasm and causes the person to miscarry. So this is another thing. So how do we diagnose them? We diagnose them based on history, on how the patient has presented, on the examination, what it is that we find. Some people's fibroids are actually significantly big in that when you assess them on the abdomen, you can feel them, like you can actually feel like it's the size of a baby, full blown. And also imaging, we tend to do imaging to also help us to understand. And so when we are treating fibroids, it also again depends on different factors. It depends, one, on the patient's age, it depends on the desire for fertility, and also depends on the size and the symptoms. If someone is having fibroids that are causing them bleeding, that's life-threatening. Of course, here now, there's chances are that we may want to actually take this thing out. Remember that because these tumors, when someone is predisposed to them, chances of them keeping on having recurrence are very high. So you find that eventually you find some women, you have just removing of the fibroids, something we call myomectomy. Some people will have a myomectomy done, but when you have a myomectomy done, it also gives you a small window within which you can actually still try to conceive, because otherwise then they keep coming back, okay? Then also remember, because they feed on estrogen, when someone is pregnant, they can also decide to overgrow and compete with a baby for nutrients. This is also another factor that we do have in place. So there is so many things that we talk about. Some people will say diet and lifestyle. I've seen videos going around that cannot be backed by scientific evidence, of people saying there was some video where someone was saying that, I don't know, when the doctor goes, I don't know, by the way, do some people think that doctors do not like them, or you think that when a doctor gives you an option, somehow they're trying not to get the best for you, when they will tell you that, you need to get this uterus out. It's going to kill you, because someone will come when they're severely anemic and you're like, what is the problem? You see, this is the source. We're trying to make sure we get the best for you, although of course we consider these different things. Everyone desires fertility, everyone desires good life, everyone desires these things, so we try to make sure that we fit in the best. When some people talk about diet and lifestyle, the diet and lifestyle, of course, we want everyone should generally have a good diet and a good lifestyle for your general well-being, but we cannot say that there are herbs that you're going to take that are going to reduce the fibroid, but you can do some things that will help to modify and generally make your way of life better. Okay, so when treatment is stopped, most of the times, unfortunately, you find that these fibroids regrow. Okay, so sometimes we'll put patients on treatment, either medical treatment with hormonal therapy, or we put them on surgical treatment. Surgical may be either just remove some of the fibroids, some surgical may require you to completely remove the entire uterus. And then also we have other methods like embolization, where we try to just like kind of kill or ban a particular artery that supplies the fibroids. So another thing that's very important to know is that also as you grow, as you get older, the moment you get into menopause, most fibroids or all fibroids definitely do reduce, because they're no longer having the hormone that they feed on. So estrogen levels go down significantly during menopause, which is another conversation we're actually going to have about menopause very soon. But so when the estrogen levels go down, the fibroids kind of get starved and then they die off. So that is also another thing. So when someone is also getting closer to menopause, instead of intervening, we can say, let's just wait and let the body naturally take its course. Otherwise, if you have any other questions about fibroids, let me know. And follow my Instagram. I tend to put updates there, much easier. It's easier for me to put them there than here, but it's easier for me to put full videos on TikTok. So otherwise, thank you so much. Thank you.